A little glimpse of what my life has been like after kidney transplant. A little bit over 3 years now, so here we go. Just finished having my guided ultrasound kidney biopsy. It's a 3-month check after the kidney transplant. And so because the kidney is placed in the right side of my lower abdomen, they did not have to put me under anesthesia. They just put a local numbing in the area, and then with lidocaine, and then they stuck a needle through to take a piece of the kidney, and then the pathologist tests that, make sure everything's okay, and I get the results back. The procedure didn't take that long. It was slightly painful, not that bad. A lot of blood though. I'm supposed to check to make sure afterwards that there's no bleeding. They said there might be blood in my stool, but I have to keep this bandage on. It's wrapped around, kind of reminds me of a waist trainer. It's taped though, so it's taped on my skin. I have to keep it on until the end of the night, and then I can take it off. Applies pressure to the area because they did use a scalpel and make an incision before they put the needle in. It was about 3 needles, 2 of lidocaine, and no, actually 4 needles. I'm sorry, 4 needles, 2 of lidocaine, and then he took 2 samples. So the needle went in twice to get the sample. It goes in pretty deep, but if the lidocaine is applied correctly, then you don't feel that much. You might feel a little pressure. You'll definitely feel a stinging of the lidocaine, but it's not that bad. I took the day off to rest. They said you could go back to work as long as like your job is not strenuous, no heavy lifting, no strenuous activity. And of course I work with kids, so I decided not to go. But all went well, and I'm just resting now, and I'll keep you updated on the results. Alright, so I was going to make a post tonight on my YouTube channel, but it is completely freezing outside. It snowed. It is just horrible, and my joints are killing me. My throat is killing me. I feel horrible. This is what the beginning of a flare-up looks like for me. I got home from work and I tried to do my normal routine of walking my dog and going to take a shower and get ready for the next day, and I couldn't even do it. Then I said, okay, let me just scratch all that and try to make this YouTube so that I can like post it. I can't even do that. I can't even put my hair in a bun because I don't have enough strength to do that. It's you feel drained, you feel stiff, it's painful. I'm curled up on my couch because I can't make it to my bedroom. These are the parts that people don't see. They're like, oh, Sam, you're so strong, you get through it. And I do. I mean, I've learned how to deal with it over the years. This is what happens, but and I didn't even want to do this quick video, but I said this will help document some of the stuff. I feel really bad, like horrible. Every time I move, it burns, or it stiffens, or it cracks. It hurts really bad. So this is the makings of a flare-up for me. It's different for everyone. As I said, everyone goes through and experiences their flare-ups differently because lupus affects different parts of their body at different times and different things for them. The weather severely affects my joints and my anemia, my gout, So I'm experiencing all that right now. I feel horrible. So I will post. You guys will see the post, but I just wanted to get this one in so you could see like my strength levels. And when I do go through a flare up, I still do. I just can manage them a whole lot better because I've been dealing with them for a long time. So I have just finished drinking some kale, spinach, and lemon juice just to boost some energy. I'm gonna drink, I'm gonna make myself some ginger drink, like a tea or just a drink, because my throat, I just try to stay ahead of it. But just wanted you guys to see. All right. My hands are still blue from being outside. I mean, they're warming up a little now, so it doesn't look as bad. But they were like super blue before. Anemia at its worst. Dealing with gaining weight, being in the hospital, gaining more weight, Solumedrol infusions, gaining more weight, just trying to work out so you could lose weight, only to turn around and gain weight again, trying to work out some more so you can lose the weight, only to gain it again after another treatment. So multiple treatments after treatments, especially if there's any rejection in your kidney at all. You have to constantly stay well and fit and active, because you're going to be on multiple medications, have multiple treatments, and those treatments have side effects like weight gain and fatigue and other things. So just trying to stay as active as possible is definitely something you will have to do after kidney transplant. And it's harder because you are counteracting medications and treatments. Back in here again. Was admitted yesterday. They said that I have a possible cyst that might have burst, and like the fluid it came out. It's an ovarian cyst, so the fluid might have leaked through the ovaries, and that's what was causing my pain. I had lower abdominal right side pain. My concern was that it might have affected the kidney, because that's where the new kidney is, but praise God, it didn't. They said ovarian cysts are common and it can go away on its own. It's just the initial pain that hurts, so we shall see. But just try to stay positive. One thing to remember when you're in the hospital is don't let them do anything to you that you're not comfortable with. They just tried to put a Foley catheter in me, and I questioned and said why, because I'm peeing normally and I'm emptying my bladder, so I don't see the reason for it. I requested to talk to the doctor, and I refused the catheter. I normally don't refuse things because I know the doctors are trying to have your best interest at heart, but you also need to know your own health and your own rights. And if you're not comfortable with something, ask questions before they do it, and don't just let them do whatever to you. Food for thought, word to the wise. At the start of the biopsy, the doctor does a regular ultrasound, and he ultrasounds the kidney to find the spot in which he's going to go in. So while ultrasounding, he uses a cap of a Sharpie pen to make a little indentation. Then he uses the actual Sharpie marker to mark off the spot. There's no needles or anything at this time. It's just to look, prep, and mark off the area that he's going to go into. Usually he talks, my doctor at least talks to me so that he calms me down because I'm a little anxious at this point. It is an uncomfortable spot to be poked at. And he is really good about just talking to me about my job, my career, my goals, things like that. So it takes my mind off of what he's doing. However, he does tell me every step that he's taking. So there's never a moment that you don't know what's going on. They walk you through it. They tell you what's happening, and they ease your anxiety if you have any. Then he preps himself and the area for the biopsy. So once he's marked off the area he's going to go in, he starts to get himself ready with his sterile gloves, sterile instruments, and make sure that the area is sterile. So he wipes it down, and then he also covers it with a covering so that nothing else, bacteria and stuff, doesn't have access to it. Usually, sometimes at least, I've been told to wear a mask, sometimes not, but just so that, like, if I'm talking or breathing, it's not going towards that area. They really want it to be sterile. So he's just wiping down the area. Then he's going to put on the drape, the covering, so that he can work. There's a hole in the covering that he's going to place directly over the area that he marked, so he can just go in that area. After the area is prepped, covered, and ready to go, the doctor then applies the lidocaine. So he will shoot you with lidocaine. For me, it takes a little more, so I usually get more than one shot of the lidocaine. The lidocaine stings and burns. It is very, very uncomfortable. It's quick, but it is painful. So when the needle goes in, you feel that, and then you feel when the solution is being injected, because it's burning and tingling and everything. And it's, if you've ever had stitches, it's the same. They use the lidocaine first and you feel all that, and then it goes numb and you don't feel anything. So the good part about it is, once the lidocaine is in, you will not feel the biopsy part. You will not feel the needle go. You should not feel the needle go in. You should not feel when the piece is extracted. You just can see it. So the lidocaine is the worst part. You could see by my face, you can tell by my face that it's painful. It is very painful. The area is tender, and you feel everything. So it is painful. I had to breathe through it. But once the lidocaine is in, as I said, smooth sailing after that. As I said, in my case, the doctor usually gives me more than one shot of the lidocaine. This is him letting it sit a little bit to see if he needs to give me another shot of it. And we did need another shot of it. So he's going to inject more lidocaine in before we start the actual process of the biopsy. You can tell when we start the actual process of the biopsy because the needle looks like a big device. It looks like a big device attached to a needle. The lidocaine is just a regular injection. It looks like a flu shot or any other little injection. The actual biopsy needle is large and long. This is very different, and you can tell the difference. And the doctor, as I said, walks you through everything. So they tell you when they're injecting you with lidocaine. They tell you when they're giving you a break for the lidocaine to settle in. They tell you when they're going to go in again. They tell you every single detail. It's very helpful for me because I like to know what's going on. I even like to watch because I like to see when the needle is penetrating my skin. It's not an element of surprise. I don't know how people close their eyes. I have to watch. Because it just helps me prepare for the pain. So I always watch when I'm being stuck. And right now, the doctor is preparing to do the biopsy. He's put enough lidocaine in there, and he's just using that covering as a surface to hold supplies and make sure he has everything prepped and ready. Before he goes in with the biopsy needle, what he just did there was he took a little tool to cut a small incision. So he cuts a small incision where the biopsy needle is going to go in. It just gives it more room to go in. So he took that scalpel and cut a small incision into the area he was going to biopsy. He's now going in with another set of the lidocaine because I expressed that I felt when he made the incision. As I said again, I need a little more lidocaine because I've had a lot of procedures, so my body is very used to the numbing agent. So I need a little bit more than other people, but he did go in another time with more lidocaine. Once you've had the first set of lidocaine, it does get a little easier because some of it is numb. You're not feeling necessarily the needle going in anymore. You might feel the medicine because it's being injected deeper. And when he is putting the lidocaine in, he's going deep because the biopsy needle needs to go deep. So the lidocaine is actually not surface level, it's going deep because he wants to make sure that he numbs that area up before he goes in with the biopsy needle. So right now he's giving me a little bit more lidocaine. As you can see, he's putting it in there and injecting it in. I'm not feeling all of that. It looks like he's poking and prodding around. I'm not feeling everything because I do have some lidocaine in already. But I do have to tell him. So I'm communicating with him to tell him whether I could feel it or not. And he's asking me questions. That's what you see is going on right there. So he's just prepared the biopsy needle, and that's what you see, that white thing with the needle sticking out. That is the biopsy needle that goes into your abdomen to take a piece of the kidney. So the doctor tells you he's about to insert, and he's going to get to a certain point, and you're going to hear some clicks and a pop. And that is when they're extracting the piece. It doesn't hurt, but you do feel pressure. You're numb, so it doesn't hurt, but you feel the pressure because for some reason the needle does something before extracting the piece that causes pressure. So they tell you you're gonna feel pressure. They count to 3 before, at least my doctor does. He says, okay, now 1, 2, 3, pop. And when he does the pop, so you see him about to press the button, that's the pop. So when he presses it, you feel like pressure. You hear the pop, but you feel pressure. So it's best to hold still, don't jump. They talk you through it, but you will feel the pressure of it. You won't feel pain, just pressure, and you'll hear pop or click, whichever it sounds in your. It sounds like a popping, clicking to me, both. So you will hear that. You will. But right now, you see the needle's going fairly deep. I can't feel it because he's numbed that whole area. He went very deep with the lidocaine, made sure everything was numb. So you could see my face. I'm very focused, but he is trying to get in there. And he's watching the biopsy machine. And that's why it's called a guided kidney biopsy, because he's biopsying. Wow. Oop, you probably saw it right there. That's when he did the pop. I didn't feel it, but I got startled because of the sound. Now, he's watching the screen because he can see where the needle, he can see the needle, he can see what's happening in it because he's also biopsying. He's using the biopsy machine. I apologize. He's using the ultrasound machine to watch what he's biopsying. So once they've extracted the piece, they take it, look at it to make sure it's what they need, the amount they need, the size they need, all of that. And if it's not, they will do one more. And if it is, you're good to go. They can start to wrap it up. The reason why you saw the blood pressure machine is you do have a blood pressure cuff on the whole time. They are monitoring your blood pressure because it is a procedure. And it's just a local anesthetic, but they still have to monitor your blood pressure to make sure it doesn't go too low, too high, anything like that. So you are, every so often, I can't tell you the time frame. To me, it feels like every 5 minutes, the blood pressure machine goes off and they take your blood pressure. My doctor is very jovial. I really like him, and that's why I'm smiling so much. He's making jokes and he really tries to take your mind off of it. So if you are anxious or nervous about the procedure, if you have a good rapport with your doctor, ask them to speak to you the whole time. It really helps. So after he made sure he got a good piece, he did one more little ultrasound of the area to make sure there was no internal bleeding. And then he is going to start to clean it up and wrap it up. So he cleans the area. There is going to be some bleeding. It's a needle. Their biggest concern is internal bleeding. So they give you a whole bunch of rules and regulations. They put a regular Band-Aid on top of the incision site. And then they use a skin tape for your skin. I don't know what it's called. I don't know what it's referred to as, but it's heavy duty and it's pretty large and tough. And it takes 2 people because they wrap it around you. So if it's not too much bleeding, sometimes they'll just wrap it from one side of you to the other side. So the whole front of your abdomen is covered. The very first kidney biopsy I got, they wrapped my whole abdomen. So they wrapped it around from my stomach to my back. So as I mentioned, they place a Band-Aid burst down, which they did already. Now they're placing gauze down because in case it bleeds through the gauze, they're placing gauze down. They have to apply pressure, so it's a little tender. You're still numb, but it's a little tender. And so they're applying the gauze. And the gauze also helps so that it doesn't stick so much, because the tape that they're going to wrap you in is really, really sticky. And here comes the tape.